thing I talked to you about stroke in the young. People have asked me many times, this man is just 15 years, how come he's having a stroke? This one is just 20 years, how come he's having a stroke? These are not stroke. They suffer the bleeding kind of stroke, which usually carries a higher prognosis. That means many times when they suffer that, they die from it. Now, migraine has been attributable as one of such things that can cause stroke in the young. Heroin. Many nowadays we see our young people indulging in all forms of substance abuse, drugs, illicit drugs like cocaine, methamphetamine, oral contraceptives among the young ladies, the need to prevent pregnancies, and all that are make them to become of higher risk of stroke incidents. There are other ones that kind of spread us to talk about. But I must mention HIV. You see that commonly among very sexually active young men and women, and that also can predispose them to having stroke. Next slide, let me not talk about this. Now, there is a stroke risk score that I think we need to know. And what is in this risk score are basically some of those things that we have mentioned that we can change. Like our blood pressure, okay, so if you have the leaflet, it's the pass around our blue leaflet. So take time out to look at them, and then you will know whether you are in the danger zone, which is the red zone, your blood pressure, your cholesterol, your diabetes status is not, you don't have, whether you smoke or not, whether your heart beats irregularly, or whether your diet is making you overweight or normal weight, or whether you do exercise, all that, if you are in the green zone, that means you are probably free from developing stroke. So let's get home and look at those leaflets again. Next slide. Now, how do we recognize whether somebody has stroke or not? It depends on the location and the extent. Next slide. Next slide. Now, this is very important. Again, it's on your leaflet. Now, the way you know whether somebody has stroke or not are what we have just represented on this slide. The facial weakness. When somebody, even many a time patient or relatives are the ones that will tell you that we suddenly notice that the mouth has bent to one side, or the mouth is no longer working on one side, or arm weakness. As in, if you raise your hand, you can't raise the hand. Raise your leg, you can't raise the leg. On one side, you know this one probably has survived the stroke. Sometimes the speech, the person was giving a talk. I've seen ministers of God, in the course of preaching, giving sermon, they suddenly slump, and you just see them going down like that. And by the time you check their blood pressure, very high. No time to check blood pressure. So it might be during delivering a speech, and suddenly the person can no longer talk. You understand? And the thing about stroke is that it's all dependent on time. It happens suddenly, and so it must be attended to suddenly, as prompt as possible. Not time to be going to a spiritualist or a native doctor before coming to the hospital. By the time you get to the hospital, maybe the damage they have done. Next slide. So we must act fast. We must act fast whenever any person suffers stroke. Next slide. Next slide. Next slide. Next slide. So now this is actually for academic purpose, to know whether it is the one that is the bleeding stroke or whether it is the one that is the clot type of stroke. Next slide. Next slide. Now, okay, before this one. If you do have a stroke, you must act fast. You must not hesitate. It's not time to be moving around looking for somebody who will put mark on the hand and the leg. You have seen that many people do that a lot. So we say, put your leg in the fire. Hit it very well. When you start moving the leg, when the fire is very high, then you will move the leg and then you know that you have responded. No. It's neck that is involved. It's not the leg. The leg is not our problem. It's the brain. That there is a brain attack, and the brain controls the leg. The brain controls the speech. The problem is not in the speech, it's in the brain. So if you must treat stroke, then treat the problem in the brain, or control what causes the brain to have an attack, which are what we have already talked about. Next slide. So it's a brain attack. So it describes the acute presentation of stroke, emphasizing the need for urgent action. Next slide. So the brain, why is it important that we must take care of the brain? It is because 200 million neurons are in the brain. And once a neuron dies, it cannot be regenerated. 2 million neurons dies every minute. Time is brain, and it's the key concept. 2 million neurons lost per minute, age of 3.6 years per hour or by pulsar. So when there's no enough blood supply, no enough oxygenation to the brain, as a result of the attack that are taking place, as a result of the bleed or the clot in the brain, those neurons they die, and the earlier you salvage them, the better. So the message here is that anybody who suffers a stroke, it's not the hand and the leg that is weak that is the issue. The issue is in the brain. So to go and be looking for a native doctor that will put mark on the leg and the hand is a waste of time. Or putting the leg and the hand on fire is a waste of time. The problem is in the brain, and that is why when you present early, there are only hours of presentation. You present early, and treatment is instituted earlier on. Many a time, the same person who came with one hand, one leg weak, you see him walk away using the hand and the leg. Why? Because early presentation. So presentation is very key. What is the roadmap? The roadmap is that first you must recognize that this is a stroke. You must recognize that, and once you recognize, you must act immediately, react immediately by ambulance services. I think very soon we'll get there, especially with the way the government is going today. Very soon we'll start having paramedics in the streets. You can call a number 911 and you hear 111, and they come and carry the man or the woman with a stroke and take to the first class, 5-star hospital that we shall soon build in Edo State. So the response must be emergent. It must be emergency department. So the moment the patient comes, they move the patient into the emergency unit, and before you know it, the care is instituted immediately. And of course, you must quickly do a CT scan. It's not that when the patient comes, that is time to start looking for money or to start calling family meeting. You don't get stroke, let's raise money to do CT scan of about 36,000 naira, which we always see here. And by the time they are gathering money, 1 week has passed. You don't even know what kind of stroke the patient has. But I'm sure very soon we'll get to the stage in our country when CT scan, as the patient is coming, are willing or high to the place and they are doing CT scan without asking to pay the dime. And then of course, treatment must be instituted immediately. And of course, there must be rehabilitation. One of the things about stroke management, apart from attending to the brain, is also to rehabilitate that part of the body that is affected. Now, how do we prevent stroke? Essentially, the message here is prevention. We have said that stroke is preventable. And so, how do we prevent it? Preventing it is simply adjusting all the lifestyle and prevention. If your blood pressure is high, get to see a doctor, let them check your blood pressure. And if it is high, you start treatment. And I don't know what is sinful about using drugs to control your blood pressure. I hear people say that, if you go and throw away that antihypertensive that they gave you in the hospital, sell your card, don't use it anymore. Use faith. And even faith say, if you don't add drugs, it becomes dead. So, if your blood pressure is high, you must reduce it. And when you reduce it, you have reduced the risk of stroke by about 40%. If you are smoking, you must stop smoking. If you drink alcohol, you should be discouraged so that your triglyceride and your HDL can get better. And of course, if you are diabetic, it must be controlled. And then, of course, you must maintain an ideal weight. Regular exercises also is key. Next slide. Then, cholesterol drop and all that is also important. Now, I'll just skip this. It's part of what I'm already talking about. Next slide. Okay, at IT age, even native doctors now use computer to tell you the equipment is on one side. Yes, so they now use computer. They no longer throw calories on the ground. So how do we treat stroke patients? The goal of treatment is to ensure that the brain is well perfused. Remember I mentioned earlier that stroke is a brain attack. Yes, and less emphasis must be on the deficit, especially when the patient presents early as within 24 hours. So that's where you see us put up infusion drip to perfuse the brain, rehydrate the individual. That's where you see us in develop one, they give drugs that can quickly go and attack the clots, dissolve it, so that the weakness on that side can become normal. So protect the ischemic brain tissue from necrosis, attempt to reverse or limit the degree of brain dysfunction. And of course, treat underlying diseases, which is what we emphasizing here today of treating the preventable risk factor. Those are the underlying diseases. Then, of course, prevent and treat complications. For someone who is going to be on the bed, not able to use hand, use leg, you must ensure that it doesn't start developing sore on that side. You understand? If he is not able to use his mouth to talk, you must initiate some form of speech therapy so that over time the person will be able to talk. So there must be some form of rehabilitation for that individual. And all these are done in the hospital, not in the native doctor's home. Next slide. Next slide. So these are what I've mentioned: thrombolytic therapy, early anti-thrombotic treatment, treatment of elevated intracranial pressure. All these we do in the hospital. But I hear people say, then we will not get stroke medicine. People in our hospital here, if you see patient, they will come, have a stroke, the family will gather, they will come like another day and tell you, doctor, we want to come home, we want to start. And why? They tell you, they say they don't get medicine for stroke, for hospital. And you see, they will carry the patient to one native doctor who will start using mark, the result and other things to mark the leg. And many a time, they deteriorate and remember again that, okay, let's go to the hospital so that you go and die in the hospital. You understand? So, that is why we must have this lecture and also carry it to our various homes to let them know that there is medicine for stroke. The medicine just now may not be the one that will make the person to start walking immediately, but to also prevent further stroke and to also perfuse the part of the brain that is also already damaged. And those are some of the things that we do in the hospital. Next slide. So, I think I thought today was Monday, so I didn't know today was Friday, but I have to say, thank God it's Friday. So thank you very much for listening.
Thank you very much, sir. Please, we can do better than that. Let's put our hands together again for our very excellent speaker this afternoon. Thank you so much, sir. Sir, please, you may take your seats. We'll ask questions. So please, let's just pen them down. After the next lecture, we'll ask questions. But while Dr. Sumbo was still speaking, the immediate past Commissioner of Health, Edo State, just walked in. Ladies and gentlemen, please, let's put our hands together for our very welcome senior colleague, Dr. Patrick Okonkwo. You're welcome, sir. Dr. Mrs. Okonkwo. At this point, we are continuing our host and senior colleague who is a mentor to a lot of us, the Chief Consultant Board, the State Hospitals Management Board, Dr. Edith Kayode-Iyasere. Please, let's put our hands together.
Thank you. Dr. Sumbo, thank you very much. Maybe a little bit of academics there, but I will tell you more on the practical aspects. What you and I must do, putting all your head into practice. This is what my talk is all about. Stroke awareness program. Okay, briefly let me talk about the Abo-EEASAF Stroke Awareness Foundation. ABO represents Augustine, Bonaventure, Omorogbee, and EEA represents Elizabeth, Ekhator, and ABO, Augustine, Bonaventure, Omorogbee was my father, while EEA, Elizabeth, Ekhator, and was my grandmother. They both died of stroke 32 and 43 years ago. So when we were doing the anniversary 2 years ago, the family came together and said, we should put up a foundation where we can talk about stroke. Because just like you have heard, stroke is preventing, and that was 2019. Like you also heard, last year we did a dance at the golf course because the World Stroke Organization told us we should do dancing as a form of exercise. If you listen to Dr. Sumbo very well, talk about lack of exercise. And dancing is one of the exercises we need to prevent stroke, and we did that last year. And this year again we are here. Just like some people have imagined, it could have been bigger. But for reasons beyond my own control, when I've been very busy doing this and doing that, I just felt I should put this together for the board, Central Hospital, and some people outside here to come and listen to mark the day. Please listen attentively. Like I said, this is the practical aspect that you and I must Thank you. To know is not to fear. What does that mean? We are told that knowledge is power. And the Word of God tells us, my people perish for lack of knowledge. I've been on the field for so many years, distributing leaflets. In fact, you have 3 leaflets on you, and you have for stroke, you have for cervical cancer, you have for breast cancer. And today we happen to be the cancer month, where we can also talk about breast cancer and cervical cancer, especially for our women. And as you know, as a medical doctor, I'm also a medical woman. And we have an association, the Medical Women Association of Nigeria, where our main focus is breast cancer and cervical cancer. And we do it from time to time. And on the field, giving leaflets to people. Some people have expressed fear. Doctor, I don't want to receive this paper from now. They put fear for somebody. No. To fear is not to know. This pamphlet was given to us in Australia about 20 years ago. So when I've been traveling and taking stuff that are beneficial to our people. Next slide, please. So we've been told stroke is preventable. We have also been told stroke is treatable. You heard from Dr. Sumro that 1 in 6 people worldwide would have a stroke. There, that was the thing. That was October 29, 2010. That was 11 years ago when we were on this campaign. 1 in 6 people will have a stroke. And we said that it will not be you in Jesus' name. And that is why we are here. But today we are talking about 1 in 4 people. And we are saying, don't be the one. Don't be the one. Next slide. Next slide. We've heard about what stroke is. It is a brain attack. And we've heard that vessels are blocked or a vessel corruption. Either way, the stroke will occur. Where is this vessel located? In the brain. He emphasized that it's not about putting marks on the body. The problem is in the brain. Either a vessel to the brain is blocked or a vessel ruptures. And when that happens, the stroke has taken place. Go on. And these vessels, they carry food to the brain, oxygen and nutrients. And so when the vessel blocks or it goes, that means the brain is starved of this nutrient. And that is why that leg or that hand can no longer move. Go on. So we heard from him too that there are types of stroke. We have the ischemic and we have the hemorrhagic. What is the difference? Next slide. That's a presentation here. That's ischemic stroke. I don't have, sorry, I don't have my pointer, but if I could. You see that shadow there? Okay, you have it there. That's the blood vessel. That's the blood vessel. And you can see what happens at the other side. The one you can see, that darkened portion, exactly. So that shows that that part of the brain is starved of nutrient, of blood. That is a dead tissue in the brain that supplies that hand and leg that can no longer move. Then on the slide, back to the hemorrhagic stroke. That is a vessel. That is the burst vessel. When that happens, blood spills all over the brain. You can just imagine a blood vessel in the brain. Blood spilling all over the brain. Can that person survive? Do you expect that person to survive? That is the hemorrhagic stroke. That is a very bad one. And that is what is represented on the other side. These are other representations. So what made this significant? The first one, that the blood vessel is blocked. A patient can go to bed, watching television with the family and all, maybe you're waking up in the morning, the hand and leg can no longer move. But the person observes that the mat is easily twisted to one side. He can tell the story. So where the speech is not taken, that patient can tell you this is what happened. This is the ischemic type, and about 80 to 85% of patients suffer from this. Whereas the hemorrhagic one, which constitutes about 10 to 15%, when it happens, most times the people are brought in unconscious. That is the effect of a bleed in the brain. Next slide. So we had him also talk about risk factors, uncontrollable and controllable. Dr. Carr, please, if there are still people in the other place, they can still find seats. Let them come in. can find 6 here. What about uncontrollable? There is nothing we can do about it. Age. I've told this story each time I keep telling it each time I give a public lecture. Is age controllable or uncontrollable? It's supposed to be uncontrollable. But people declaring official ages, isn't it? Once upon a time I ran a clinic and there was an elderly man before me. But when I looked at the case note, it was showing 50 years. And I said, how old are you? He said, where is my picking? I am 75 years old. I said, official age, I was like our first speaker said, we don't cut out what the body really is. So also gender, I also mentioned transgender. We now have people becoming male, whereas they were female, whereas they were male, but it does not matter what God has given us. Then race, multiple nationalities, family history, previous stroke. In the beginning, the word of God says it was not so. So we stick to what is in the beginning. So those are the uncontrollable risk factors. There is nothing we can do about them. But the controllable ones, those are the ones we can do something about. And that's why we say stroke is preventable. If you do something about these ones, stroke is preventable. The first thing we'll talk about then is know your blood pressure. There's what we call ejaculation, and we'll elaborate on that. If you smoke, if you drink, your high cholesterol movement, diabetes, exercise, low sodium, weight reduction, no symptoms of stroke. Go on, because we are already spoken about them. High blood pressure is a major risk factor for stroke. All over the world. All over, not about this part of the world or that part of the world. All over the world, high blood pressure is a risk factor for stroke. If you are 40 and above, you mentioned 50, but I'm taking it to 40. If you are 40 and above, and look, some of us are 40 and above here, you must have your blood pressure checked every year. But if you have a family history, so like I just told you, having a grandmother and a father that died of stroke, you get both hypertensive, you get diabetic, you get overweight. So that shows there is a family history. So if you have a family history, you can check your blood pressure at every 6 months. Next slide. But next slide talks about even checking it more often than to say every citizen should have their blood pressure checked by healthcare provider at least 4 times. You can check it more often. And what I'm advising here today, we have instruments for checking blood pressure. Very simple ones you can easily do for yourself. Easily to check it. I know there are issues with that because I've had patients. Every day they are taking their blood pressure. Every minute they are taking their blood pressure. That is not what we are advocating here. Normal blood pressure should not be more than 130/80. BP exceeding this must be reported to the medical practitioner for proper check-up. If you are hypertensive, talk to your doctor. Your doctor may recommend some drugs. Changes in your diet and recommend some drug changes in your diet and advise on regular exercise. I highlighted that please. Take your drugs regularly and be regular with your clinic visits. A lot of people don't take their drugs because they are saying, doctor, am I going to be taking drugs every day of my life? That is the question on ground. And I said, do you eat every day? That is the question, okay? Do you eat every day? And the answer is yes. Make this one your second food, or even make it more important than your food. But there are some drugs we cannot take without eating. I advise the men, before you give money to your wife, make sure you have separated your money for your drugs. It's as serious as that. It is to be taken every day until God intervenes. And you hear it clearly. Don't take those drugs. But this is where I have problem with church people. I'll be talking to them on Sunday in my church, by special grace of God. They spiritualize everything. But God has given us this knowledge, and we must put it into practice. Take your drugs. Come to the clinic when you are told to come to the clinic. Don't take your drugs when you are about going to see the doctor. Some people will start taking their drugs 1 or 2 days to the clinic, they start. So that when the doctor asks them, have you been taking your drugs, they can say, yes. Who are you to say? It's your health. You don't have to do that. Take take your drugs. It is very important. And some also specialize. Like I said, those who have their instrument at home. When they take the blood pressure and it goes up, they take their drugs. When it comes down, they stop. We don't manage BP like that. Please, we don't manage BP like that. Take your drugs. Obey the rules. Use those drugs and want to stop it if need be. I've had to stop 1 or 2 persons, giving them, even when I stop, I still tell them come for regular clinic visits. I'm still monitoring. And first of all, the BP begins to go up again, and at that point you intervene. So even if you notice that your BP is low, let the doctor be one to decide whether to reduce those drugs or to tell you to stop. Don't do it on your own, because a lot of people are taking unawares. This high, low, and by the time the blood pressure goes up, a stroke comes up. And you say they'll be taking their drugs, you will not be taking it. You'll be doing it your own way, the way that seems right to you. That's what the word of God says. Hypertension is a silent killer without symptoms. A lot of us here now are hypertensive taking drugs. We don't know. That's what we mean by silent killer. Does not announce himself. Some people have told me, but I see the, when you tell them even better, they say, but I see the work now, the thing never be like that. I say, I'm the one addressing this BP. By the time it comes down on you, you regret not obeying what I'm telling you now. By the time BP begins to give you problems, it's already telling you there are complications like stroke. Stroke is a complication of high BP, the aftermath of high BP. Just like heart failure. The heart failure can also occur suddenly. When your leg begins to swell and you have high BP, that's already a complication. But we are saying we can avoid all of that by obeying the rules. If you are hypertensive, take your drugs. If you are hypertensive, see your doctor. If you are hypertensive, please go for your regular clinic checkup. Thank God this is an hospital environment. You know us. We are here. I am here. Dr. Sumbo is here. Dr. Edith is here. The residents are here. Dr. Sayende, all of us are here. The physicians. You can easily walk up to us. Nobody should be ashamed of ill health. We are all exposed. We are all vulnerable. But there's something we can do to avoid all of this. Next slide, please. Talking about hypertension in the young, like talking about stroke in the young. Even young people are not scared. All of us are involved. So this talk is for all of us. And then what we call atrial fibrillation, when you palpate your pulse. Can anyone put their hand on the right you already know what to do. You will feel something hitting your hand there. Do you feel it? Yes. It should be regular. It comes up at regular interval. Justice, are you feeling it? Exactly. So it comes up at regular interval. But when it becomes irregular, that means it's not coordinated. You are not feeling it regularly. It means there's already a problem. And that again can be a risk factor for stroke. So when you notice that, it is time to see your doctor. Next slide. Smoking, we learned about that. If you smoke, stop. If you don't smoke, don't start. Don't start. Smoking is not only a risk factor for stroke, it's a risk factor for a lot of diseases in the body. Name it. A lot of young people still smoke. Not just smoking, but the hard ones, cocaine, marijuana, all of that. All of these are all health risk. So also alcohol, do so in moderation. But I would say don't start. I know when we go to parties, we all organize our own to a little alcohol, and some people have said, take a little alcohol for your stomach. Although the Bible says, take a little alcohol for your stomach's sake. Some people have taken it up on that. And I say, at that time, you have any stomach ache? At that time, you're taking the alcohol, you have the stomach ache. So, honestly, medicine, which stomach ache do we take alcohol for? I can't even remember any, but I know there is in neurology, DET, then essential treble, that could be one of the things we used to assess that disease entity. But we don't even prescribe it. So please, if you take alcohol, take so in moderation. And some also say alcohol is good for your heart. A little red wine for your heart. Again, it's not a license. It is not for a heart that is already compromised by hypertension and other risk factors. Even the cardiologist will tell you that. Don't take that red wine. Please tell me have some quiet. Let me see what other way I'm doing quiet. So, a little alcohol, red wine for your heart is not good for a heart that is already compromised by hypertension. Like I said, if you really go into the history of hypertension, you will get 1 in 3 adults, 1 in 5 adults, 40 years and above are hypertensive. So if you can't be adults here 40 years and above, 1 in 3 is already hypertensive. So taking alcohol does not really arise. Can we move on, please? Cholesterol, you have emphasized that. If you have a high cholesterol, also tend to seek a doctor. By God's grace, we'll be doing our medical outreach, we'll be doing BP, blood sugar, and all of the things we need to check. That's the value there, and you also have that leaflet. Please go through it as you carry out your own check. Make sure the values that are being quoted were within the low range that he emphasized. Next slide. Diabetes, that's another big entity with us in Nigeria. Blood pressure, diabetes mellitus. A lot of adults also have high blood sugar. High blood sugar is the same preaching. If you know your blood sugar, you can take your drug. This is another disease entity, you must take your drug every day. Every day. Don't go to the Chinese people that use machine or whatever. I've had patients. They will come. I had one that only God delivered him. He was attending the clinic and we didn't see him again. And by the time I was seeing him again, blood sugar has gone very, very high. Hey, Papa, Joe, where have you been? They took us to somewhere where they were using machine to do our bodies and all that. Computer. You know. Please take your drugs and obey the doctor. But I don't also like to listen to other people, except what the doctor is telling you. No two individuals are the same, even twins. That this person has diabetes, I have diabetes, doesn't mean what is good for him is good for me. So you must also bear that in mind. They will just tell you, now this one I take. You two come and take this one. No, there are doctors around. When they talk to you, listen. Don't go and do it your own way. I'm not sure to do it their own way because they think it is cheaper and simpler for them to do. So they just obey. A lot of people don't like coming to the hospital. They are looking at the waka, spending a whole day. But we are here. That puts you at an advantage. So you don't have any reason to do it otherwise. Like my first speaker said, people have a stroke and you see them go to the native doctor and put in a mask. That has happened among us. Doctors do the same thing. Why should that be? Putting masks, and by the time we're saying we are alarmed, say, you did this. And that is, we talk about time is break. Go ahead. So if you are diabetic, the value is also there. Make sure you do your blood sugar, and make sure you, when you use weight control, the drug that will be given to you could be both oral or injectables. Then your lifestyle, right? Gone are the days when we used to say diabetes should eat beans, plantain, where the neurologist is here, maybe during question and answer time tonight. Say a word or two. We no longer say that. We don't sentence people to a life of beans and plantain anymore. I think what we are concerned about now is the quantity of food, the quantity that you should reduce this, reduce that. But you can eat everything, so to say, but that doesn't mean you can take a bottle of Coke and just because even as at that, have the wisdom enough not to eat a high carbohydrate diet as you are doing that. You know, you'll be so hungry and that is what is available. Of course, you can do that to replenish yourself, but we also want you to have low blood sugar, which is equally very dangerous to the brain. So if you are on drugs, take it regularly and maintain a regular clinic attendance. We cannot emphasize that enough. Exercise. These are the various exercises you can do. How many of us are doing exercise? Let's be honest. Take time out every morning. Maybe wake up 5, wake up 6. Some people do it. I have a junior sister who is so regular on that. Every Friday she has woken up and she's doing that. I don't wake up every Friday, but I do my exercises. I do. Because I don't preach what I don't do. Paul said, for those of us who read that, you that preach, do you do what you preach? Very important. So these are the exercises. Exercise 5 times a week. You cannot do it 5 times. At least 3 times a week. Walking. You can easily walk around our houses. So you don't need to go and even register in the gym. You don't need to do that. Walking. Running. You can run around your house. And swim for those who are comfortable enough. Have a swimming pool in your house. You can go to the stadium wherever you can easily have access. Tennis court. Domestic work. You see, domestic work can also keep us on our toes. Jogging, biking, golf. Those for the high in the society. Dance. You did dance last year, like we said. You can dance. Every opportunity you have to dance. Dance. People are so tired. Even in the church, the music is going on. You are working on that and dancing. Instead of you to dance your own dance. Climbing the stairs. We have houses that have staircases. Climb up and down is a form of exercise. So these are things that you can do within the house, within your compound. So easily. Don't need to go elsewhere to make this happen. So please let's try and do what you have been told, because these are very, very tough. Then diet, no added salt. No added salt. So people have asked, what do I mean by no added salt? Are we saying we do not cook the salt again? No. Not saying so. We are saying if the food that we cooked, not on your table, put salt. In fact, that table salt should be eliminated from the dining table. I went somewhere not too long ago. If you eat their food, you won't like to eat. Everything is saltless. I have to tell you, wow. Obesity. Implying excessively fat, carrying on the abdomen, it is associated with stroke risk. Check your weight at least once every month. So when we talk about obesity, we use what we call the body mass index. That's like BMI. That is what means weight over height squared. You measure your weight and take your height. You can also do that if you have a weighing scale. Put the height scale on the wall, and you measure your height and weight. Normal weight is between 18.5 to 24.9. That is normal weight. Overweight is 25 to 29.9. Obesity is if your BMI gives you a value of more than 30. You'll be surprised some of us are overweight or obese because of our heart. So it's weight to height. You're not just looking at the human, you are okay. You know. A sedentary lifestyle, sitting disease. Like it's often preached, some of us we live in air-conditioned houses, air-conditioned offices, air-conditioned cars, and there's no exercise whatsoever. Sitting disease, this can lead to weight gain. So as much as possible, avoid sitting down for a long period. Maybe after sitting down for some time, you can deliberately take a walk, deliberately. Then it is a misconception that being fat is a sign of wealth. You know that is the slogan some time ago. So it's a misconception that being fat is a sign of wealth. Eating a lot of fatty foods increases the chances of obesity. A lot of them like a lot of oil, butter, bacon, all those fatty things. We are not saying we should not eat them, but like the word of God says, there should be nutrition, everything. Nutrition. You know yourself. You know what you should eat. You know what you should eat in moderation. You know what you should eat in excess. Next, so your income. A lot of us have high income jobs. So when we go to the supermarket, we are seeing a lot of beautiful things on the shelf. We want to buy them. We want to eat them. Your income should not change your eating habits. Eating fast food should be discouraged. You know, we are very careful to talk about that because we have a lot of eating joints all over the place. Of course, once in a while you can go there, but don't make it a habit. And you also spend a lot of money there to buy those things. So don't make it a habit because you have very high income, you can afford to do it. We are saying your income should not change your eating habits. It should not. You should eat healthily. Symptoms, yes, and just because speak on it. What I want to emphasize there is the sudden. What are the things you notice when you have a stroke? Sudden weakness of the hand and the leg on one side of the body. The face will be involved, and when the face is involved, that's when you hear people say, "Doctor, my mouth twists to one side." It's a sudden numbness or weakness of the face, leg, especially on one side of the body. Sudden confusion, trouble speaking. Like he also said, you've seen men of God, not even men of God. I was in a gathering. I was not in a gathering. It was a man that was in a gathering, speaking as the chairman of the gathering. I was in the hospital when they rushed in that man. Dressed in white, sparkling. He said, the story was that he was talking, the way I'm talking, and he slumped. And we rushed him to the hospital. This was a man who left home, passing, going to a place and location. See the word sudden. It does not announce itself. It's not like when your legs are swollen, you know, oh, something is wrong. This one does not announce, or you are feeling breathless, so something is wrong. It just comes suddenly. And they brought the patient to the hospital. And the church members, when they heard the whole truth, I didn't even bother, just allowed him, because in case he was in deep coma by the time he had arrived in the hospital. And we were praying. Then I was just a junior resident, and I sent for my senior doctor. But by the time I didn't work the following day, the man had passed on. What kind of stroke is that? Hemorrhagic stroke. There was a bleed in the brain. That's what I said earlier. If the vessel burst and the blood spilling all over the brain, can that person really survive? That was exactly what happened. So suddenly, he does not announce himself. That's why we must take this kind of lecture very seriously, especially this practical aspect, to do the things we must do to prevent stroke. And everybody can with high blood pressure. High blood pressure. And if a male, it also said the male sex is also more at risk than the male and the women folk. Next slide, please. So sudden severe headache. Patient can present, doctor, it was headache of my life. That's what we talk about, so that meant the hemorrhage. It was headache of my life. So if you are interested in this one, you may have a TIA or a mini stroke. If you think someone will be having a stroke, act fast and do the simple test. What is the simple test? Next time. This is the simple test. I think he also talked about it. This is what we can do at home. Especially for the ischemic type, not the hemorrhagic. This is for the ischemic type that about 80 to 25 of people suffer from. You look at the face, ask the person to show his teeth. If the person shows his teeth and there's a deviation of the face to one side, the stroke probably would have taken place. Then ask the patient to raise both hands. Does one arm drift downwards? So it means this hand is weak. Did you know observe that? Tell the patient to show both hands. So this one is dropping. You show this is the weakened hand. Then speech. Ask the person to repeat a simple sentence. At the worst, Lord, can he or she repeat the sentence correctly? I think you are all hearing me clearly. But the patient that has a stroke, you don't have a speech, you can't hear what he's saying, or you cannot even repeat that sentence. Then if the person shows any of these symptoms, time is important. Get to the hospital fast. Brain cells are dying. Next slide. We cannot emphasize that enough. Time is brain. Time is brain. That is the slogan for this year, or the theme for this year. Saving precious time. Saving precious time. You heard him say a lot of people don't come to the hospital. People believe stroke not a no hospital. And that's slogan. Stroke not a no hospital. And in the Western world, they're going to call traumatic therapy. They didn't have time to really elaborate on that. I'm going to call it down to little time. From when the patient had the stroke to when they put that therapy, within 3 hours, if a patient will present to the hospital, that situation can be reversed for the ischemic time. That's when the vessel is blocked, not the hemorrhagic one. So this is time is brain. What are we saying here? See, minutes can save memories. So those are the things that are affected when the stroke occurs. Your memory, your mobility, your independence, your speech. All of these are compromised. And we are saying time is brain. Minutes in bringing that patient to the hospital can save the patient all of this. See, it is also represented there. They say when somebody has a stroke, every second that goes by is crucial. As brain tissue and millions of neurons begin to fade away, time could not be more precious. The Precious Time campaign continues to raise awareness about stroke symptoms and the importance of acting fast. Once upon a time again, I was at home when I was called. It was one of the PS in the Ministry of Health that called me that said, my sister, please, I have a relative who just had a stroke. And it was a Friday. I don't run clinic on Fridays. I said, okay, I don't run clinic on Friday, but because of you, let them bring the patient to the hospital. So and so time when the clinic will be opened. I told my nurses to be on guard because the patient is coming. And they came. We were there, I evaluated the patient, and I said, let me admit the patient so that we start what we want to do. Then I said, okay, let them go and discuss. And I was waiting for the discussion. To tell them, what is happening? Call the woman who came with them that I know very well. So what is going on? I said, I don't know. They said they want to carry the patient go wherever they will, at least not the hospital. I said, why? This thing is beyond me, no, it's family. When family decides individual this thing, I don't know exactly what happened. Whatever became of that patient is not in our duty. I didn't follow up, and I don't know. But that's what most people do. I just give an example of one of us who also did that. Rather than coming to the hospital, they say we don't have to do this therapy here. But whatever we do, the conservative management saves lives. It does. Where I trained, where I have some of posting in Lagos, University of Lagos, under Professor Damisi. In fact, the man was given a name. Once the patient has a stroke, when Professor Damisi attends to that patient must come out walking perfectly with his 2 legs and his 2 hands moving. There's no community therapy there. The conservative manual, because the patient has come on time, and whatever we do can still go a long way. So don't say stroke not a no hospital. Even church people, like I said before. Members, there was one man sitting behind me and came. My wife had a stroke. I said, how long ago? He said 6 months. 6 months? You are coming 6 months later to tell me that your wife has a stroke? In this same church that these people that have disputed their time and time without knowing. Don't you know I'll be talking about stroke? He said yes. Then what happened? Another sister the same way. Didn't you know I'll be talking about stroke? I said yes. But we went out. What became of him? The same thing. And by the time they are coming back 6 months later or 1 year later, the hand that would have been straightened or even walking has developed stiffness, what we call contractions. That hand can no longer come down, move up, and that becomes stiff. Whereas if the patient had presented on time to the hospital, that could have been avoided. And the patient probably would have hoped. Yes, not just to recover, some recover fully, some partially, some not even recover at all. And you are around quickly. Let that patient come to the hospital. Be able to convince them that there's something the hospital can do. But that and that, what we are here for is prevention. We don't want anybody to have a stroke. Because stroke, we are told, is the commonest cause of severe disability. It disables. If it doesn't kill you, it will disable the person. We don't want that. Just another slide. Yes, go on, it's the same thing we are talking about. So what are we talking about here? The risk of stroke and other major vascular events can be reduced effectively by sustained blood pressure lowering, sustained blood cholesterol lowering, optimal control of blood glucose, smoking cessation, increased activity, increased body weight, decreased salt and alcohol, increased fruits and vegetables. pray when you do all this, the good God will save all of us from stroke in Jesus' name.
Thank you very much, man. I think that we can go lecture. So at this point, we'll take questions. We want to quickly recognize the presence of the head of department of the dental Central Hospital, Benin City, Dr. Mrs. Rebecca Esezabo. You're welcome, ma'am. We also have a consultant pediatric surgeon in our midst. Please let's put our hands together for Dr. Iyasere. All right, we also have in our midst the Reverend Gentleman, Resident Pastor, Church of God Mission International Faith Arena. So let's take your questions. What if I don't smoke cigar, I used to smoke shisha? You know shisha? You used to Okay. I don't know, I need to take questions. I also want to recognize the presence of the head of department of the Department of Family Medicine, Dr. Musa, in the house. Please let's put our hands together for her and you ask your question.
I want to stand on existing articles. I am Asemuta. I want to start by thanking the presenters for this wonderful presentation. And I want to say that I've been listening to lectures, medical lectures like this. This one seems to be the one I enjoy the most. And I also want to say that I initially would have tagged this the most fearful lecture I ever heard. Then she started by saying to know is not to fear. So that one tells that. Then my question has to do with the role of stress in all of this. Stress, occupational stress, problems, you are thinking. Because we are talking about BP, we talked about other factors that will relate. But I want our guests to tell us the role of stress in all of this. Then secondly, the issue of smoking and drinking. Some people have formed it a habit, and when you try to correct them on it, they said that it helps them to control stress. Are you seeing what I'm trying to look at here? If stress contributes to this, and they said smoking and drinking help them to, relieve stress, then how do we reconcile that? That is the question. Then again, lastly, from the way we have looked at stroke, the way and BP is said to be one of the major high BP, let me put that high BP, one of the major contributing factors. Then I think, in my own opinion, we have centers that support other public health illnesses, like HIV, like even diabetes. Why is there nothing to support people that are prone or sufferers of high BP, which is not of their own making? So